Hi there, I'm Matt Christensen, the executive editor of the Quad City Times and the Dispatch-Argus, your hometown newspapers. I'm here today in the Times newsroom, which is mostly empty because our reporters have been working remotely since the pandemic started. I'm here to talk a little bit today about COVID-19, and like everybody else, we're going through some of the same problems and struggles that people out there in the community are. And we got to thinking about trying to get some experts together to help answer some of those basic everyday questions that maybe you haven't seen yet in the paper or other media. So today we've gathered experts from the Quad Cities who are on the front lines of the fight against COVID-19. They include Dr. Katz, who's the medical disease expert at the Scott County Public Health Department. Nita Ludwig is the public health administrator at the Rock Island County Public Health Department. And Emily Gordon joins us. She's a licensed counselor at Family Resources. Today's forum is going to be moderated by Andrea Olson, who's executive director of the Ideas Factory, a consulting firm in town that helps folks get big ideas out like the ones we're going to talk about today. I hope you enjoy the forum. It's a town hall style, and the questions are taken pretty much directly from folks like you. They're going to include information about whether it's safe for my kids to attend sleepovers, or is it safe for me to go visit my family? Questions that we know you have, and we're happy to provide answers to. To make it a little more digestible, we've broken the forum up into two 20-minute segments. We hope you enjoy both. Thanks for joining us.
So speaking of mental health, how do we effectively manage our stress in this complex time where there's COVID, and then there's also these other things going on in the world, and school is going to go back online here shortly. What suggestions would you have for our community on how to, manage stress in a more healthy and better way? Okay.
I think it's very much about being planful about coping skills and taking care of yourself. So scheduling that time in to even think about, okay, I need to do this to take care of myself today. And then looking for what those individual things that help are. So being really cognizant about that. It is a really, really stressful time, and we have to be super planful about how we're going to do that.
Oh, for sure. And speaking of those big decisions on how to manage your own stress and just be cognizant of how you're using your time, how do you make big decisions such as elective surgery? Something that maybe has been on the list, you want to do it, but now with COVID, do you make that decision? Is that a yes or no, or is that something you would suggest putting off?
Oh, it depends on what it is. There's elective and there's elective. I wouldn't get a nose job now, but if I needed my hip replaced in order to walk, I think we know enough good infection control stuff that if that a elective but life-changing surgery like a hip, I think that can be done safely. Now, you need to spend a little bit of time doing your homework about how the facility that you might use is controlling risk. So it depends on what it is. If I had the choice of not being able to walk around or getting an elective hip, which I sort of need, but not right now, I wouldn't hesitate to have my hip done at a place that passed muster from an infection control standpoint. I think that can be done. We've learned a lot. We know how to control risk in healthcare settings pretty damn well. And so talk to the provider, understand what the institution's doing, and make the best judgment you can make.
Oh, for sure. And that's great advice. Again, it still sounds like there's a consistent pattern of really thinking consciously about what decision you want to make, what risk you want to take, and weighing the pros and cons between that. But, there's always people in the community that maybe have a different opinion or perspective. And one of the questions that's come up is I have elderly parents that maybe don't want to wear a mask, or I have friends or neighbors that don't think a mask is important. Is there a way or effective approach for me to help encourage them to do so, to protect not only themselves, but others around them?
I think in public health, we kind of struggle with this all the time because we have a faction of the public that either doesn't think it'll work or just they're uncomfortable or whatever the case may be. But again, without an effective treatment or a vaccine, that really is your best tool to keep yourself safe in this time, and just to reassure them that, it's not forever, that we just have to do this until we can get that vaccine and get people safe. I think I would also recommend some of the really fun masks that are out there. I mean, we're starting to see all kinds of fashion masks.
There you go.
I have my Cubs mask, so I think I would try that angle with people.
Friends, don't let friends wear Cub masks.
Oh, well, we'll leave that controversy to another time.
I wash your hands every time you touch the logo.
Oh, really? Oh,
Being a Cardinal fan, it's easy for me to say.
fair enough. Fair enough. Yes, go ahead.
Yeah. I also think you can. Go ahead.
Well, the other thing is, it's not just protecting yourself, and people need to understand. I get it if you don't like it, but remember, you're protecting the people you come into contact with as well. It's the social compact. In a certain sense, it's just good manners. And so if you don't want to wear a mask, I think you should consider not going out where other people are. And I think that's an acceptable decision. But if you can be out where you could expose other people, I think you really have a responsibility to use barriers as recommended by public health.
For sure. Emily?
I think the other angle here is if there are people in your family that you feel like you said something about if it were your parents or someone like that, then I think you can kind of use those basic communication and counseling skills. So people tend to not like advice giving. That doesn't tend to really work very well. But if we can listen more than we tell them what to do, so if you can kind of ask some questions and try to get to the reality of the problem and problem solve, sometimes that's a little more effective. And then I think the other thing you can do is really talk about how it impacts you, which talks about what Dr. Katz brought up. So you can use those I statements about, I feel really scared that you could get someone else sick, that you could get sick. I feel worried that it's not safe, rather than just saying you should do this. I think you can figure out ways to communicate that in a different way that can be helpful.
Oh, definitely. I mean, and that's great advice. And that begs the question in regards to masks of, should businesses require patrons to wear masks across the board?
My opinion, yeah. That you don't wear a mask, you can't come through the door. We have had a problem in Iowa with getting the kind of support we want from the state government on the issues, particularly of masking, but other things as well. And one really good way to protect the public is if private business owners would just take the bull by the horns and require it. And I think that would be wonderful. And in fact, we're seeing more and more of it as the days and weeks now of the surge roll by. More places in Scott County saying, we'd love to have you for a customer, but not without a mask. And distancing and hand hygiene stations, and all three.
Mm-hmm. Nita?
Sure. I think it really helps us in public health when the retailers do make that decision, because otherwise there are some places that do and some places that don't. We really don't have public health staff that are the mask police. We are not out chasing everyone down or writing tickets or anything like that. So if the businesses choose to require it, that's great. We're very grateful of that.
Oh, for sure. For sure. And the other question is not just in businesses, but in just general travel. So if I travel out of state, should I quarantine for 2 weeks? If I do that, when can I get back into the community? Is that something that's strict or flexible? Does it depend on where I go? What's that quarantine process look like?
Well, I think if you live in New York and you come from Iowa, you're in quarantine. That's their recommendation. So it depends on where you're going, where you're coming from. Yeah, I think it's different if you're in the metro area and go someplace. That probably is higher risk to where you're traveling than someplace up in northwest Iowa, a county where they've had a small handful of cases. Pretty hard for average people to access data at the level that would be necessary to try and make those judgments. So we make blanket judgments, and the EU says if you are in America, you can't come here. And Chicago or New York says if you were in Iowa, you got 2 weeks. Those are blunt instruments, but it's what's operationally doable. Unnecessary travel is unnecessary.
Emily or Nita, anything to add to that?
Yeah, that again, I think comes back to the personal decision making and deciding, is this trip really necessary right now? Is it somewhere that has a lot of transmission going on, like Texas or Florida or somewhere like that? And maybe I don't need to go at this point in time, and I can wait and see how it is in the spring.
Yep, it sounds like it all centers around a lot of personal responsibility and judgment, and trying to make the best judgments with the information you have available, and putting your family and yourself and your health first and foremost above everything else. But, a couple last questions for everyone here. With COVID and living with COVID, Emily said it's been since March for her. What has changed in your lives? What habits have you picked up? What habits have you maybe eliminated? What's the unique thing that's changed for you since all of this has come about?
I'm antisocial, so nothing.
For me personally, I'm tired of just going to the grocery store and back. I like to go to movies. I like to go to restaurants, and really haven't been doing any of that. If we do eat out, it's usually, take out and take it home sort of thing.
Mm-hmm. Emily?
I would say a lot more activities outside than inside, which is always going to be safer. And so I think that's definitely changed for me. I know I've said the self-care thing several times throughout here, but I've been pretty careful about that myself, because I think it's important to set an example. And I also think this is going to be stressful for people for a long time, and the mental health world, we have to be prepared to deal with that. I do a lot of consulting with other counselors, and so I work a lot with them about talking about, okay, how can we take care of ourselves? Because there is going to be plenty to take care of for a long time out of here. So I've really done a lot more of like mindfulness stuff that I usually do with clients, doing a lot more of that on my own and kind of figuring out, these are the things that I know work for me, and so I'm doing these. And being really planful about it. And I also have learned lots of new ways to do things. I mean, I've done a lot of things virtually, support groups and telehealth and stuff that I would never have thought I was going to do on a computer. So I would say a lot of things have changed. And it's not all bad. It's just different, and that's hard. That's overwhelming.
Change is hard, and change is hard, especially when it comes in such a fast and furious way. Right. If you had time to digest this over a longer arc, it would be a lot easier to manage. But, that's the big question, is how long do you think that we'll have to live this way? And do you think, the vaccine is going to be that changing moment? And when do you think that is going to happen? I think those questions are on everyone's mind.
I think that we're dealing with a lot of masking and social distancing and hand hygiene and difficulties making decisions about schools well into 21 and maybe into 22. To get a vaccine that we know to be both effective and safe is the first of the year, optimistically. And then ramping up to levels that allow us to back off on the non-pharmacologic interventions that we've been talking about for the whole hour is longer than that. So people, I think, take a deep breath. We're doing this we may be having very similar conversations in July and August next year. I hope not, but I think so. So,
Nita and Emily, would you agree with that assessment from Dr. Katz?
I think so. You know, it's hard for us to imagine living like this for that long a period of time, but it is very realistic. And then once there is a vaccine, then the public health partners will be the ones getting that vaccine and having mass clinics and distributing it to our partners who can also do clinics in their healthcare settings as well.
I think that's what's tough about this is the unknown is just a really hard thing for humans. And there's so much unknown. There's not knowing when it's going to end. There's not knowing necessarily what the right decisions always are or how to help other people make those decisions. And I mean, we're all dealing with that right now. Kids are dealing with that. Adults are dealing with that. Mental health professionals are dealing with that. And we all have to kind of give each other a little grace and do what we can to take care of each other. I think the other thing that's really important to mention is you should seek support if you need it. So if you're feeling overwhelmed, there are ways to access all kinds of services safely. And so making sure that people know to do that. I mean, I work for Family Resources, so I'm going to put the plug in for them. They have an array of services that can help you, but there are all kinds of mental health and support services for people. And I think especially people who have had trauma or have had really difficult things in their lives are going to be really triggered when the anxiety level is what it is right now.
Sure.
So making sure that you're accessing those supports, whether it's some sort of like AA treatment that you need to access online, or it's just your informal networks, or if it's professional help, is not being afraid to step out and do that if you need to. So that's an important piece of this as we continue to live with kind of this unknown, uncertain reality.
Oh, fully agreed. Fully agreed. Nita, Dr. Katz, any other final thoughts you want to throw in as well?
Well, I think, and I might be stealing this from Dr. Katz, I'm not sure if I heard it from him, but we all need to learn to coexist with COVID, right? So this is our life for a while, and we just have to learn to manage until such a time as we have effective treatment or vaccine. So it could be a while.
I never said that.
Oh, you didn't? Okay, I stole it
but
from
I wish I had. I mean, it's true. It's obviously true. Yeah, just take a deep breath.
Amen to that. Well, with that, thank you, all three of you, for taking the time today to talk. You've answered a myriad of questions. They've all been great, and I'm sure that there are more to come. So appreciate your time, and thank you for your insights.
You're welcome.
Thank you.
Thanks.